I'm Scott in the system, and I believe this is episode number 3 for season 2. And our guest today is Lacey Charboneau from AAAWM in West Michigan. And hello and welcome.
Thank you, Scott.
And I believe you are the advocacy coordinator and planner, correct?
That is correct. Yep.
How long have you been doing it?
I've been with the agency for going on 3 years. In November will be my hire anniversary. So
Okay.
I started out just doing advocacy, and then a couple years ago kind of added the planner position into my role as well.
And that's where you basically plan for like community advocacy events and so forth, or?
Actually, the annual implementation plan that I write is kind of like a report to the state on how we use our Older Americans Act funding and how we kind of administer those dollars and what programs those that money is funding in our 9-county region.
Okay. And I guess what you oversee and facilitate is what we call the advocate senior issues. And what is that exactly and their mission?
Sure. The Advocates for Senior Issues is one of my favorite projects that I get to work on at the agency. It's a group of over 350 members that meet at Frederick Meyer Gardens 9 times a year. And we always have a legislative presenter along with some type of program. So we usually have either a representative or a senator come for the first hour of the meeting.
Interesting.
Yeah, it's really great. And we get to ask them questions and kind of put them on the hot seat during that time.
That was going to be my follow-up question. Grill them a little bit, so to speak.
We do. We always try to have questions that are relevant to issues for older adults and adults with disabilities, and kind of how they're working in the legislature to support programs that support older adults. And then we always have a program that's relevant to seniors in some way. We've done a lot of different programs about dementia or aging or even the environmental issues, just things that we think are relevant to the times.
I would say transportation be another one.
It definitely comes up over and over and over. And the fact that we don't currently have public transportation to get to Frederick Meyer Gardens is also currently kind of on our mind all the time, which is why we actually do meet 2 times a year off-site in an attempt to try to make the meetings more accessible.
Oh, so therefore, Go Bus does not go to Frederick Meyer Gardens.
You know, I am not actually certain if Go Bus goes to the gardens, but I know that there's not one of the public buses, one of the regular rapid buses that goes.
Okay.
I don't want to speak for Go Bus. They might go there.
Yeah. I haven't been there, so I can't say for sure myself. We'll follow that up later, folks.
Third Friday of the month in September. See if you can find your way to us.
It's the 3rd Friday every month.
Yes, we take July, August, and December off.
And I was going to say, how could people get involved? That would be one way.
Absolutely, yep. Everybody is welcome to come to a meeting for free. You don't have to join right away. You can come a couple times and kind of get a feeling for what the meetings are like, see if it's something that interests you, and then decide to join after that. And then membership includes a free lunch every time that we meet at the gardens, and you can tour the gardens for the rest of the day if you'd like. So it can be a pretty interesting day.
Yeah, as such as go observe the plant like they had last week.
Yeah, I heard they had a smelly plant, the corpse plant. Is that
Yeah.
I'll skip that one, thank you.
Yeah, I think I would agree with that one. Some of the senior issues I'd like to go over. The first one is called hospital observation. I became aware of that a few years ago. And I guess you can explain it better, but as I understood it, that is basically determining how you're admitted when you go into the hospital, either as an inpatient or observation, and that can all determine if it's approved or not by Medicare. Would you mind elaborating on that?
Sure. We have had a lot of issues with people not knowing whether or not they were actually admitted as an inpatient to the hospital or they were there for observation, because it can look exactly the same. If you're in the hospital for observation, you may still have a room, you'd still be getting your medications, you'd still be seen by a doctor. It looks almost exactly the same as if you were there inpatient, so it can be confusing if you're not made aware of whether you're there inpatient or as observation. And the problem comes after you're discharged. If you go to a rehab facility, typically if you've had a qualifying inpatient stay, Medicare will pay for your rehabilitation stay. However, if you are only in the hospital for observation and you get sent to a rehabilitation facility, that's where Medicare is not going to pay for that if you are only in the hospital under observation.
So it's not the observation per se, it's the aftermath, what occurs after?
So the aftermath is where those big charges that you hear about. You'll hear horror stories of people who were on the hook for thousands and thousands of dollars. The observation stay, you could be charged for some things, like your medications wouldn't necessarily be charged. Sometimes Medicare will reimburse you after the fact, but that piece is still can be, of course, a financial burden for someone, but not nearly to the scope as if you end up in a rehab facility and then you have all those charges incurred while you were staying there if you didn't have a qualifying stay.
Wow. That could get quite expensive depending how long you are in a rehabilitation center.
Yep, and so now we currently have a nationwide law called the Notice Act, which requires doctors to tell patients whether they're being admitted for observation status or if they're being admitted as an inpatient. And so we're excited to have that legislation in place. The problem with that legislation is they have 36 hours to tell you, and by the time 36 hours goes by, you may have been under observation for 36 hours and not have realized
so
it.
So it's basically a day and a half
Yeah.
or so, I guess.
Yep. So we always kind of recommend that if you are conscious and able to ask questions, you want to ask right away, am I going for observation or am I going to be inpatient? And if you are not, you want to make sure that your healthcare advocates would be able to ask that question for you. And so we do have a great brochure. If anybody is ever looking for more information, we're happy to share that. And our MAP program within our office can always help people who have questions about inpatient or outpatient.
So that I would assume would be directed to Bob Calorie himself.
Correct. Yes.
The man.
Who's had his own episode here, I believe. So
yes, that's right.
Refer back to that episode.
Yes, and we're due to do another one in October. Our next topic would be state funding for in-home services. And I think we just discussed this a little bit in relation to self-determination. Would you care to explain this to us?
Sure. So just a quick distinction. Before we started on camera, you and I were talking about self-determination, and I think we were talking probably more about the waiver, the My Choice waiver program. And some of the advocacy that we've done on the in-home service side through a coalition and advocacy group called the Silver Key Coalition actually advocates for a different pot of money that comes from the Aging and Adult Services Agency, and those are Older American Act dollars. And those provide in-home services for people who don't need a nursing home level of care. They might just need help with a shower or help with getting their groceries, or they don't
basically ADL stuff.
Yes, right, and not quite to the same level that someone who is utilizing the waiver might need. Probably less hours in the home, maybe not every day. But those in-home services prevent people from needing to go to a nursing home, and they help people stay in their homes longer and stay in their homes safer. So those were the dollars that we were advocating for this year. We were asking for $3 million, for $500,000 for home delivered meals, and then $2.5 million for in-home services. And we got that $2.5 million for in-home services. We didn't get the increase in meals, but we got the increase in the home services, and that's really where the bulk of that waiting list is. So we're really hoping to serve everyone who's currently on the waiting list in Michigan.
So I guess what do you do for the funding that wasn't received for the Meals on Wheels?
So we will continue to serve all of the clients that were receiving meals before. Especially here in West Michigan, our Meals on Wheels provider has been really great about raising additional funds. They're not solely relying just on the funding that comes from the state. And so I think we're pretty confident that people will be able to access meals and still continue to serve those people who need those services. I don't believe, at least in our area, that the waiting lists were as long for that service. And what we'll really continue to do is next year start all over again and start advocating for an increase for the next fiscal year.
Yeah. So basically, it comes down to perhaps not being able to take on new customers or clients that are on the waiting list, so to speak.
I'm actually not certain we have waiting lists here for meals, and again, and I can only speak to our area, but what we won't probably be able to do is if someone's only getting one meal a day, we won't be able to increase it to 2 meals a day right now.
Okay.
But I think everybody is able to get meals if they need meals.
Oh, okay. So we don't have a huge problem of people falling through the cracks of the system per se.
Hopefully not in the meals department.
Right. And this next issue is a big one, unfortunately, elderly abuse.
So in Kent County, we have a very strong elder abuse coalition, the Kent County Elder Abuse Prevention Coalition. And that was headed by a staffer in our office who's actually recently taken a different position. We have a new person coming up who's really excited to take over that group. And this happened at a really good time because they're on summer break. But there are a lot of community members that are part of that coalition. Adult Protective Services, Chris Becker's very active, our Kent County prosecuting attorney, as well as lots of different police departments come. And so we get together once a month and have some kind of presentation and then talk about different cases and sort of troubleshoot on how we can best assist older adults and help prevent elder abuse. We also talk a lot about what recent scams might be happening because, as I'm sure that you're aware, it's just ever evolving. People are always finding out new ways to trick people or coerce them out of money or find new ways to scam.
I see a lot of these kinds of things on the evening news, and sometimes it can be quite heartbreaking.
It really is.
I don't know how they sleep at night, that's all I can say.
Yeah, I don't know, it's terrible. So we're constantly working on that, and we also do outreach through our office and do presentations and try to make sure that people really know what to look out for and what to be cautious about.
So is it a fair assumption to say these type of things occur more on a psychological, emotional level as opposed to physical, or?
You know, I don't know what the stats would say as opposed to physical versus emotional, but certainly those scammers that are non-family members that are just catching you by phone or on the internet or knocking on your door, they're definitely playing on people's emotions.
Yeah, their sympathy or
they're
vulnerability or whatever.
Sure. Yep. They're either tricking them into thinking that they're someone that they're not, like a grandchild, or there's a lot of Cupid scams so they're tricking people into thinking that we're going to get married, or I'm going to come from overseas and we'll start a relationship or something, and so that's where the money starts getting sent back to that person, the scammer. So there's certainly a lot of that, but that happens with families too. I think a lot of not so great family members take advantage of older adults as well by playing with their emotions.
Yeah, dear old grandma or grandpa has a few bucks, so let's go after it. I can't imagine thinking that way, but I guess that's the world we live in today.
Yeah.
Our next topic here is Kent County Senior Millage. I think it might have talked about that already, but yeah, go ahead and explain that to us.
So the AAA administers the millage, which is a fairly large, substantial pot of dollars that come in from millage funding. And we have numerous partners that provide all kinds of different services that allow seniors to stay in their homes longer. So those dollars fund such a wide variety of services that range from showers and bathing to recreational opportunities, to meals as well. The millage helps fund meals. And so it's really just a whole network of aging services that is supplemented really by the millage and all the funding that comes in through Kent County. And each one of our counties throughout our 9-county region also has a senior millage, but we don't administer those funds. Each county does something a little different with their dollars, but they all do have a supplement to the funds that they get from the state to help supplement their senior services.
Okay, so each county, breaks it up accordingly into different types of services.
Yes.
Might vary from one to the other.
Absolutely. Yep. And in some counties, I think all their millage dollars go to one organization, and then that organization takes care of all the services. And some counties operate like us, where they have an entity that oversees those dollars, and they kind of grant them out.
Distribute it accordingly. Okay.
Yep.
And our next one here is transportation, which is a very vital part of our lives in general, especially for those that depend on public transportation, only.
So transportation is, I'm going to say, is not my expertise. You could probably school me on the issues with transportation. I know that we have a staff person, Kendrick Heinlein, in our office that does a lot of work with transportation, and he could probably answer any specific questions. But I can tell you that I see we're on the edge of some really new and innovative things. With on-demand transportation, I'm personally hopeful that we can really kind of figure out how to utilize that better to fit individuals' needs, so that we can have people going from this place to that place as they wish, instead of relying on a huge bus to stop multiple times along the way. And so I'm hopeful that we're kind of on the edge of technology being more helpful for everyone.
Yeah, like Uber service that might have a van and wheelchair accessible.
Exactly.
That's very hard to comprehend at this point in time, but that would certainly be wonderful.
I think it's coming. I really do.
You do, yeah.
I do.
Because typically, for folks such as I, it is not uncommon to get on something like GoBus and have an hour and a half plus ride from point A to point B.
Yeah.
I could do a whole nother show on GoBus horror stories. Next topics are about what are strategy groups, and the first one is Health One.
So the Advocates for Senior Issues, the group that we had talked about kind of at the beginning of our conversation here, currently has one strategy group that meets, and it is a long-term care kind of / healthcare group. And so this is a group of people that get together. Some of them are care providers, some of them are just advocates from our group. Others, there are a couple of physicians that attend that group, and they get together before every advocates meeting and talk about different advocacy issues that they want to work on. They have spent quite a bit of time talking about housing and issues around lack of affordable senior housing, and how to come up with some creative solutions to address that issue. They've also done a lot of advocacy with the Silver Key group that I mentioned before, advocating for increased funding for meals and in-home services. And so they just kind of get together and brainstorm and talk about issues that are relevant to older adults and how they can kind of maybe either write a letter to legislators or kind of start working on a work group to advocate for these, whatever issue it is that they're working on. So that's just kind of a choice that people can, if they would like to attend a strategy group before the advocates meeting, that's always an option.
Yeah, so they can, go over what the current issues are and have a plan of strategy.
Yep.
Okay, and our other one is long-term care.
Yeah, so those two groups have kind of just melded into one group
okay,
for now.
okay.
So they kind of operate as one unit as opposed to two separate groups.
Okay, and so they're kind of almost one.
Yes, they are.
Blended together.
Yep.
Okay, and to wrap things up, are there any current events you would like to talk about?
Things slow down a little bit in the summer because the advocates do take a little bit of a break. But I would encourage you and anyone in your audience that would be interested in checking out the Advocates for Senior Issues. The third Friday in September will be kind of our kickoff meeting for the new program year. I'm really excited. We're going to be having a speaker, Rick Pluta from Michigan Public Radio is going to come and talk about all the different ballot initiatives that voters will be seeing on the ballot in the fall in November. And then we're going to also have a training on becoming dementia friendly, becoming more aware of how to interact with people with dementia in the community. And so again, that's a free meeting, a free event to attend at Frederick Meyer Gardens starting at 10 a.m. on the third Friday in September.
And how long do those go for typically?
2 hours, so it would be 10 to noon.
Okay, and I'll let you guys know if GoBus goes there. I'm pretty sure they do, but I'll have to make sure.
Sounds good.
Okay, well, this is Scott from Scott in the System, and thank you very much for watching. Have a good day.